And welcome back to North of the Broad. Megan Radcliffe has joined us. She is the Director of Patient Outreach for Hospice Care of the Lowcountry. Nice to meet you.
Nice to meet you.
So what we're talking about today is the difference between hospice care, but really palliative care.
Yes.
And what is the difference between the two?
Palliative care really focuses on symptom management and control while a patient is receiving treatment for a terminal illness. So it really provides continuity of care to make sure all the providers in a patient's role is being communicated with. So we're staying ahead of those side effects from treatment as well as that disease process. Palliative is involved while you're receiving treatment. So it doesn't mean that we've stopped hope. We're going to continue that journey with you and provide you additional support.
So is it for patients that basically are struggling with chronic diseases over a long period of time?
Can be.
Okay.
It can be. We have patients who receive a new cancer diagnosis and are brought into palliative care to help manage those side effects from their treatment.
Okay.
Goals of care to make sure that goals are met.
Mm-hmm. So let's talk about who qualifies for palliative care.
Any individual in our community who is facing a chronic or terminal illness, regardless of age and regardless of treatment status.
Right. Okay. And Megan, what kind of services do y'all provide?
So palliative care is overseen by a physician and a nurse practitioner. That patient will see their nurse practitioner. The very minimum is about once a month, but can be as much as every week. And as the family dynamics, disease progression, and situations change, they can have additional services brought in, such as a social worker or chaplain, to walk through the process that they're dealing with.
Okay. And so how about pay? So does Medicare and insurance companies pay for this type of care?
Absolutely. Medicare, Medicaid, and most private insurances do cover palliative care services.
All right. And so how do you know, or family or patient knows that maybe this is something I need? I need this type of care.
You can ask your provider, the physician involved in your care, but if you're noticing more trips to the ER, you're noticing that your symptoms aren't well managed at home, things are happening in between your visits, that would be a great cue to say, hey, let's see if I have some additional services I qualify for, such as palliative. And even if we're not the right level of care, we're going to help guide you in what would be the next step that's appropriate.
And so with the full breadth of services that Hospice Care of the Lowcountry provides, where does this fit in? Is this one of a plethora of offerings you have for patients and families?
Yes. So palliative care fits in with our continuity of care. We're well before we get to the hospice stage.
Okay.
So as we're seeking out those treatments, providing guidance, and knowing what the next steps are is where palliative fits in. And it really connects us back to our community and making sure that we're honoring those patients that we're able to service.
And so let's talk a little bit about you. A little bit about your background. We have about a minute left. A little about your background and what services you provide for hospice care.
So I have a really nice title of Director of Patient Care Outreach and Physician Services. I am a marketer, but I focus on our providers. I'm working with our hospital systems, assisted living, skilled nursing, anybody who would have a need for hospice and or palliative care services, and providing those educational pieces. What conversations like we're having right now, what is the difference? Who qualifies? When is it time for that to be involved? And I've had the pleasure of providing hospice care in the Lowcountry for over 10 years.
And is there a lot of misinformation about hospice care and even palliative care?
Absolutely. Unfortunately, we have a lot of providers in our community who try to use those two interchangeably, but hospice and palliative are very, very different. And a lot of people think that hospice means I'm imminent. This is the end of the road versus we can't have things done to us anymore, so let's have things done for us and let's focus on our comfort as our journey goes.
Right, very good. So if we are wanting to get in touch with you all, how do we do that?
Absolutely. So you can call us at 843-706-2296 or visit us at hospicecarelc.org.
And I love that you're a not-for-profit.
We are a not-for-profit.
Which I think is very, very important, makes a difference. Say hi to James, who's the Executive Director. Good to see you.
Yes, you as well.
And we'll be right back with more North of the Broad. Don't go away.